So I work for a major U.S. high-tech company. I'm an engineering manager there, and I am also a dental phobic. Hello, my name is, and I'm a dental phobic. I don't know how I became a dental phobic, but I do have memories in my childhood of a free clinic near my house. I have memories of this big open room with a single dentist chair in the middle. It feels sort of dungeon-like. But I don't have any memory of the specific event or events that made me a dental phobic. But the difference between dental phobia and fear of the dentist is I was so bad that I could not even drive myself to the dentist physically. I couldn't drive myself to the dentist. Forget about going into a dentist's office. I had to have someone drive me there. There was a 10-year period in my life where I did not go to the dentist at all. And finally, the pain in my mouth from the work that needed to be done, I needed all 4 wisdom teeth out. I had some impacted teeth. I needed root canals done, crowns, just basically everything. I had, not just fillings, all sorts of work that needed to be done. And so I had a friend take me to a dentist in the East Bay. At that point, I was living over there. And I did make it to the dentist and actually into the dentist office, but couldn't make it into the chair. Just couldn't do it. So this dentist alerted me to the existence of IV sedation and referred me to Frank Grimaldi in San Francisco. So this was back in the early 90s. I had my friend take me over there. And I don't remember the first trip to Dr. Grimaldi's, but I do remember him talking about what it was, taking me through very detailed description of what it is, what happens, the effects, the after effects, what to expect. And the way he described it, it seemed like a pretty good thing relative to the pain, and he would be able to deal with that pain. So I had also gone to a psychologist before this who specializes in dental phobia, and he was good. He took me to a dentist office and had me sit in the chair and had me play with the tools and listen to the sound of the drill and all that. And I think the idea was to give me experience without the pain of all the noise and whatnot to help me overcome my fear. But unfortunately, that was not getting my teeth fixed. So, and I needed to get it done. I was really in pain at that point. So I had my friend take me and actually made it into the office, and slowly Dr. Grimaldi got me in there, and I got over the fear of basically the only thing that you feel is a small needle. It's easier to do IV sedation than it is to give blood, actually, because it's a pretty small needle. So, and he has 3 things that I think are key to a good IV sedation dentist experience. One is the technology. I remember in the early 90s, I worked for Silicon Graphics, SGI, the company that the technology behind, at that time, groundbreaking movies like Jurassic Park and Beauty and the Beast and whatnot. So I was into graphics, and he was also highly into technology. He was using virtual reality glasses, the kind that just covered your whole face, to try to help his patients. I think he specializes in dental phobics, help them overcome the fear. So he's always been on the cutting edge of the use of technology. So one is technology. 2 is his bedside manner. I mean, absolutely, he will describe everything in detail in a way that's so you know exactly what's coming, and it's not. It eases the fear. It's hard for me to describe how he does it, but he's terrific. And actually, the other people in the office are as well. I mean, it's the whole staff is actually really good. They seem to be geared specifically towards dental phobics, because there's a difference between the way they treat you and the way I've been treated at other dentists, where you're a patient. This guy's not. I'm not a patient. I'm a dental phobic. So, and the third thing is skill. So there's technology, bedside manner, and skill. And I know about his skill only because I've been to other dentists since him, both of whom have commented on the quality of the work in my mouth. And I know because they've lasted, the stuff that he's done has lasted for a really long time. So, despite all sorts of problems. These three together make for a great experience. It's basically you go into the office, you sit in the chair, and you fall asleep. When you wake up, you're done. You don't know what happened. And you feel a little drowsy for a while, but that's about it. And you get over it pretty quickly. And what has happened for me as a dental phobic is over and over again, I've had these experiences. You go to the dentist's office, you fall asleep, you wake up and you're done. And then you go, you fall asleep, wake up, and you're done. This over and over again. I have now started overcoming my fear. So I can actually drive to his office and go in myself and get in the chair myself, which, again, for a dental phobic is a pretty amazing thing. And I've had all my work done on my teeth. They are fine now, so thanks to him. So I highly recommend, if you're afraid of the dentist, or if you think you're a dental phobic like I was, definitely check out IV sedation. And in my opinion, Frank Grimaldi is a master in the field. He's been doing it forever, and he's really good at it.